Kathryn Serkes is president and founder of the Square One Media Network, and for more than 15 years, Kathryn has also served as the public affairs and policy consultant for the Association of American Physicians and Surgeons, and represented the group during its litigation against the Hillary Care. She is an Emmy Award-winning producer and reporter, and co-author of Patient Power, The Patient's Handbook. Ms. Serkes sits on the Health and Human Services Task Force of the American Legislative Exchange Council, and she is here to talk to us about health care today.
Thank you. Ignore all that stuff she just said. The most important thing was I got to speak on the steps of the Capitol on September 12th. So that was very exciting, of everything that I've ever done. And I was there in front of the couple thousand people, of course, as was reported by CNN. So I'm thinking maybe there were 2,500 there. Well, I'm going to talk to you about health care reform. And I wish I had some more cheerful news, but I want to start out by telling you exactly where I stand so that you know what my bias is. And I'll tell you, when it comes to health care reform, I am pro-choice. I think that patients should get to decide where they get their health care from and what treatments from their doctors, not the government and not the insurance companies. So we'll just start off by saying that. We are in favor of health care reform that puts patients and doctors in charge. And that's not what we're hearing out of Washington, D.C. The other thing, I might as well go ahead and introduce her since she's upstaging me at the moment. This is Phoebe, who is a service dog. We do disaster search and rescue work. So she goes everywhere with me. So thanks. Say hi, Phoebe. So if you just listen to the news reports, you'd think that doctors are all behind this, wouldn't you? It's kind of hard to tell, which is probably very confusing. You think, what's going on? If doctors are supporting the president on this, what am I missing? Well, I'm here to tell you, representing the Association of American Physicians and Surgeons and thousands, tens of thousands of doctors across the country, doctors do not support what's going on in Washington, D.C. What's happened is the AMA has sold you out. The AMA has sold out patients and doctors for their multi-million-dollar monopoly in a government contract. And you probably don't even know about this. I'm going to tell you as quickly as I can. There are codes, these 6-digit codes that doctors have to use, all healthcare providers, not just doctors, that when they fill out an insurance form or any kind of billing device, they have to use that coding system. The government requires them to use it for Medicare, Medicaid, VA, etc. Insurance companies require them. But the government doesn't provide those codes to doctors for free. They have to buy them from the AMA. So this is worth between an estimated $76 million and $100 million to the AMA. So they almost have a virtual guarantee that they'll get to keep control of those codes. And that's the price that they've paid to sit at the table. So that's why I say they've sold you out. Now the politicians say that we don't need health care reform. Our politicians say that we need health care reform. And in fact, what we say is that we don't need health care reform, we need government reform. The government is the biggest problem right now. The government is what is driving the prices up in medical care. The government is what has made it an unfair playing field so that your insurance premiums keep going up and up. You know, the doctors take an oath to do no harm. How about we try to get politicians to take that oath? What do you think? Do no harm. Very few could honor that right now. Let me tell you about some of the things that government does that gets in the way. Right now, we have government medicine. We have Medicare. Except that about 1/3 of doctors in this country right now refuse to take new Medicare patients. Everybody will tell you, oh, that's because it's about those greedy doctors. They just need more money. Well, they also restrict the services to their existing Medicare patients. 40% of the doctors who take Medicare patients actually restrict services to their patients. It's not about money. Our survey shows money is the number 5 reason that doctors give for that. The biggest reason is what we call the hassle factor. It's hassles or threats from government and the insurance carriers. Now let me pose this question to you, and I bet you can figure this out, even though the folks at Capitol Hill can't figure this out. If we have more government involvement in medicine, is the hassle factor going to go up or down? Of course it's going to go up. Paying the doctors a few dollars more is not going to fix the problem. It's the hassle factors. Doctors want to be left alone to practice the best medicine they can for you, the individual patient, not what some government agency cookbook says is the right way to practice. And they need you to help cover their backs. If you help cover their backs, they can take care of yours when you need back surgery. So that's my message here today. Let me tell you some more what the government does in medicine. Doctors and their staff spend 1/4 of their time on Medicare compliance. Not Medicare patients, Medicare compliance. Again, you think that's going to go up or down if we have more government involvement? It's going to go up. It's going to get worse. And they tell us, oh, it's going to streamline medicine. We're going to consolidate all those insurance forms and everything. Not true. It takes doctors and their staffs 50% longer to process a government insurance claim compared to a private insurance claim. So there you have a couple of examples. Let me tell you about some of the other hoops that doctors have to go through because of government. Every doctor has to provide a translator for non-English speaking patients that comes into their office. And the doctor has to provide that translator at his own expense. Well, when you're getting paid $13 for a Medicare patient's office visit, and that's about what it is in most markets, it starts at $13 to $18. I pay plumbers and mechanics and tradesmen more than that. When they're paying $15, $20, getting $15, $20 for that office visit, the translator's going to make more than the doctor will. Why should they have to? Imagine anybody, you have small business owners here? What if you had to pay for a translator to translate for every customer who came in your store? It would devastate you if you were subjected to that kind of regulatory regime. There are more regulations, federal regulations, governing doctors than there are in the entire U.S. tax code. There are more pages. I think last count was it's over 200,000 pages that doctors have to know. And they're supposed to know that and medicine. So how can they, something's going to give. If they don't pay attention to those regulations, they can go to jail. If they don't keep up on their medicine, they can't take care of you as well. Well, they're going to try to make sure they don't go to jail, which means it takes away from patient time and takes away from their learning time to keep up with things.